It's 1 a.m. You're lying in bed, exhausted but awake, scrolling through forums on your phone. You're typing things like, "Why does my body hate me?" Or, "Normal labs but still tired." If you've been there, welcome to the club none of us applied for. Hi everyone, welcome back to the Earthy Cures channel. Today we are having a real talk. We're talking about that moment when you walk out of a doctor's appointment after waiting 3 weeks, and the whole thing is over in 10 minutes with a slip of paper that says, "Let's try a different dose." You feel dismissed. You feel unseen. And you're not alone. Here is the plain truth right off the bat. Modern evidence-based medicine is a miracle. It excels, truly excels, at naming a problem fast and targeting it with tests, drugs, surgery, or radiation. That speed saves lives. But what happens when your life isn't in immediate danger, but you still feel terrible? That is the gap we are exploring today. We aren't here to drag doctors, and we certainly aren't here to pretend that drinking tea is like drinking a magic Hogwarts potion. Today, we're going to compare what conventional medicine and natural remedies are actually designed to do, how you can use both smartly, and, most importantly, how to do it safely. Because yes, even the gentle stuff has risks. Let's get your agency back. I want you to imagine a woman named Maya. Maya is juggling a full-time job and caring for aging parents. She's burnt out. She's bloated. She's breaking out in weird skin flare-ups for the first time since she was a teenager. She finally gets an appointment with her GP. She waits 3 weeks for this slot. She has a mental list of everything that's wrong. The fatigue, the stomach issues, the skin. She gets in there and the clock starts ticking. The clinician is competent. They are good at what they do, but the system is overloaded. The visit is optimized for efficiency, usually for triage. Maya tries to explain the whole picture, but in under 10 minutes, she leaves with a prescription cream for her skin and a polite, "Let's follow up in 3 months. Notice what didn't happen?" No one asked Maya about her sleep. No one asked about the 3 iced coffees she drinks to survive the day. No one connected the stress of caregiving to her stomach or her skin. This is the emotional gap. When your symptoms are treated like checkboxes on a form, you don't just feel unheard. You can actually feel guilty for taking up space. And that emotion? It saps trust. It makes you less likely to follow through on your health. So why is this happening? It helps if we stop thinking of it as good versus bad and start thinking of it as 2 different toolboxes. This is the conventional medicine toolbox. The US clinical workflow is a machine designed for focus. You have a symptom? They order a lab. They order imaging. If something is broken, infected, or failing, this toolbox is the best in the world. If you have a heart attack, a broken leg, or an acute infection, do not come to me for tea. Go to the hospital. The goal here is speed, symptom relief, and stopping disease progression. Now, this is the natural or whole-body toolbox. This is where people turn when the labs come back normal, but they don't feel normal. This toolbox frames health as mind, body, spirit. It includes herbal medicine, acupuncture, nutrition, and movement. It's not about a quick fix, it's about the long haul. The reason so many of you are turning to natural remedies isn't because you hate science. It's because you have a chronic, lingering issue that the red toolbox isn't designed to fix. You're looking for broader support. I read a comment on our blog recently that really stuck with me. Someone asked, "Is it wrong to want a miracle?" Here is my take. I don't think you are looking for a miracle. I think you are looking for agency. When you are in pain or tired all the time, you feel helpless. The standard medical advice of wait and see or take this pill can feel incredibly passive. Turning to natural remedies, whether that's tracking your triggers, tweaking your sleep hygiene, or trying a new supplement, gives you something to do. It puts the steering wheel back in your hands. It's about testing your boundaries. If I change my breakfast, do I have more energy? If I use this adaptogen, does my stress feel more manageable? That isn't woo-woo, that is data. That is you becoming the expert on your own body. However, And this is a huge, bold, underlined however. We need to talk about safety. There is a misconception that natural equals harmless. That is simply not true. Arsenic is natural. Poison ivy is natural. You wouldn't put those in your smoothie. Herbs and supplements are biologically active. That's why they work. But that also means they can be surprisingly chatty with your prescription drugs. For example, St. John's wort. It's famous for helping with mood, right? But it also speeds up how your liver processes drugs, which can make life-saving medications, like birth control or blood thinners, less effective. The most important rule of the Earthy Cures philosophy is transparency. If you are taking supplements, you must tell your doctor. Even if you think they'll roll their eyes. Tell your pharmacist. Say, I am taking a turmeric supplement. Is that safe with my blood pressure med? We want you empowered, not in the ER because of a bad interaction. So what does the ideal future look like? It looks like integration. It looks like using both toolboxes. Let's look at some real-world examples of how this works. In the best cancer centers now, you see integrated care. Patients are receiving chemotherapy. That's the red toolbox, attacking the cancer. But they are also receiving acupuncture to help with the nausea, and meditation coaching to help with the terror and anxiety of the diagnosis. That is the wooden toolbox supporting the human behind the disease. Or take chronic back pain. You might need a prescription anti-inflammatory to get the inflammation down so you can move. But the cure might actually be in the yoga class, the chiropractic adjustment, or the stress reduction that stops you from tensing your shoulders up to your ears every day. Complementary care supports, it never replaces, medical diagnosis. To wrap this up, if you are feeling unheard by the medical system, your feelings are valid. You aren't crazy. You're just a complex human being in a system built for quick fixes. Earthy Cures is here to be your lifestyle companion. Think of us as the bridge. We want to offer you the education, the habit tools, and the gentle methods you can bring to your doctor's plan. You are in charge. Track what you take. Watch for changes. And treat your healthcare team like a team. Yes, even if scheduling an appointment feels like a boss fight in a video game. If you enjoyed this deep dive, please hit that subscribe button. We are going to be breaking down individual herbs, specific routines, and more interviews with integrative experts in the coming weeks. Don't just scroll at 1 a.m. wondering why your body hates you. Let's start listening to it instead. This is Earthy Cures. Be well, and I'll see you in the next one.